It was an experience which I will never forget, but it was good experience.
Within the historic Royal Free Hospital in London lies a dedicated team of professionals committed to improving the lives of people with liver disease. The team is now at the forefront of diagnosis and treatment around the world. Mohammed was referred to the Royal Free in 1998 after being diagnosed with hepatitis C. It was while on a trip abroad that his health really took a turn for the worse.
In February 2000, me and my wife went to Saudi Arabia for pilgrimage, and in Medina I was very sick and I feel sharp pain in my liver. And we come back London, and the specialist, he said, your liver condition is very bad. And he said, now is the time for transplant.
As soon as a patient is on the transplant list, they will then see a transplant coordinator. This is just the beginning of the care they and their families will receive from a dedicated team of as many as 20 professionals.
Our role is mainly to support the patients and their families through the whole process of transplantation. We see the patients initially when they're referred to us for assessment for transplantation and organise their tests and talk to them about what the tests involved and what will happen once we get the results back. We then organise the actual transplant operation itself when we have a liver offer, and also again give a lot of information and support to the families and the patients at that time. When we know that there's a liver suitable for a patient, we would contact the patient, and usually they would need to come in within a couple of hours of us calling them.
At 7 a.m. they took me to the operation theatre. I say goodbye to my family, and I told them, don't worry, just pray.
The transplant procedure itself usually takes about 5 hours, sometimes a little less if it's a relatively straightforward procedure, and sometimes considerably longer if it's more complicated.
As transplant coordinators, we would always go into theatre with the patient because it's quite a frightening and anxious time for the patient and for the families. And then for the rest of the transplant, we would keep in touch with the families to let them know how things are going and when they're expected out of theatre.
It was very important that we were included every stage of the treatment. From the start, the liver coordinators, they explained the whole procedure to mum and dad, and they came and explained it to us, what to expect, all the medication dad was given, why he was acting a bit different when he was on steroids and things, and they told us everything.
After a liver transplant operation, one of the very pleasing things and satisfying things, most for the patient obviously, is that they can feel better very, very soon afterwards. If you've had a transplant, you are a patient for life, but we hope you will be a well patient for life.
I stay 4 weeks in Royal Free, and I come home, and now every 3 or 4 months time I go Royal Free for my checkup, my appointment, my blood test. It is nearly 8 years and I am perfect, 100% okay I feel, and healthy, just helping my family, enjoying with my family, especially now my grandchild, first grandbaby.
All of us, I think we'd all, agree to be donors now as well, It's something that I'd never thought of before. But after the transplant, to think that somebody else has given that to my dad to have a second life, I wouldn't hesitate now to be a donor myself.
Clearly the best way forward for the future of liver transplantation is to have sufficient donors to do the standard operation very well.
We work very hard to try and convince people that donation of organs is the right thing to do.
At the end, I am very grateful to Royal Free Hospital.